Hi, my name is Dominique Vincent. I'm the Executive Director of Blossom Birth and Family located in Palo Alto, California. I wanted to talk today about something that's been weighing on everybody's minds a lot, um, and hopefully to bring you guys a message of hope. The past several months have been particularly painful as we've borne witness to the repeated visceral examples of the devastating effects of centuries of systemic racism playing out in everything from police brutality to the disproportionately severe effects of COVID 19 on the physical and economic health of the Black community. Although there is deep pain in the community, this is also an opportunity for change. Blossom seeks to be a part of this change. As part of our mission, we advocate and lift up the voices of the underserved and underrepresented. And women are an underserved population. In particular, women of African descent in the United States are 3 times more likely to die from a pregnancy related cause than others because of racial biases that exist and that they experience before and during their pregnancy. A new mom has said before, we as a society do a terrible job of taking care of mothers and after the baby comes out. It's like the baby is the candy and the mama is the wrapper. Once the baby is out, sometimes the wrapper is just discarded or forgotten. We're making sure, we're working to make sure, really, that mothers don't feel that way. Our aim is to serve mothers by connecting and supporting them pre and postnatally. Two of the phrases that we hear most often are, I wish I heard about Blossom before I was pregnant or earlier in my pregnancy. And every city should have a Blossom. I agree. The Blossom staff and the board of directors are working to ensure the Blossom space, whether it's virtual or in person, is a safe place to learn, share, be heard, and participate, especially during these unprecedented times. To make this hope a reality, we have moved classes online, allowing the same high quality education and support to take place in a safe manner. We are also continuing our volunteer doula partnership with the Valley Medical Center. It's Santa Clara County's largest public hospital and a site of uninsured births. Even when it's safe to reopen, we are committed to operating with both a physical and an online presence because we believe that parents who are supported and informed during this critical time of childbearing are more likely to raise healthy, secure children, making our community stronger now and into the future. To end, I have some requests of you today. First, that you would please continue to seek out the services that Blossom offers. We have everything ranging from childbirth education, support groups, daily prenatal yoga. We have a retail store. You can rent a birth tub from our facility. You can check out our provider listing and see other birth workers in the community that are out there to serve you. Now more than ever, people need a safe place to share their worries and concerns, to connect with others, and to get support. Share our offerings with others who might benefit. People can take advantage of this anywhere in the world, really, because it's online. Second, please let us know how Blossom might respond and support you. And lastly, please continue to reflect, listen, and learn about where you can take action and be a part of changing the status quo. Some local maternal health organizations serving the African descent community to check out include the Roots Community Clinic, there's a South Bay location and a location up in Oakland, Black Women Birthing Justice, the Preterm Birth Initiative out of UCSF, and the Black Infant Health Program. It's a public health program through the state of California. And my final hope is that I can be of support to you. I'm open and available to anyone who wishes to have a respectful dialogue about what it means to be an American woman, a parent of color, particularly one of African descent like myself in the United States. Tonight, I hope that you take a deep breath and hug your children just a little bit closer. And if your baby's hasn't made it topside yet, that you give your belly a big squeeze too. Also, if you might be in a position of privilege, that you just try to be aware of it. Recognize the times when you might be experiencing that privilege. And for some, you might just recognize times in the past where you benefited from that privilege. In general, I really hope that we can all open ourselves up and push others to know that it's okay to be a little bit uncomfortable. I think Dr. Seuss said it best. Unless someone like you cares a whole awful lot, nothing is going to get better. It's not. If you have any more questions or you want to reach out to us, we're happy to serve you always. You can learn more about Blossom through our website, www.blossombirthandfamily.org. Thanks, and have a good night.